Hi, my name's Jess. I'm going to be doing an infant assessment on a newborn baby girl that is 24 hours old. So, the APCOR score, checking her reflexes, and checking for any deformities have been done already. Before proceeding with my assessment, just going to make sure that, my equipment's ready, that it's within arm's reach, because I'm not going to want to take my eyes off of the baby, and I'm going to want one hand on the baby at all times because they do have a risk of rolling off the table and injuring themselves. And I'm going to make sure that when I'm examining the baby, I'm going to try to keep her as covered up as I can at all times, just because the baby does lose heat quite quickly and you want to keep the baby warm. And, if the baby is crying or you're starting to see that you're stressing out the baby a bit too much, you can comfort her and soothe her by using a soft voice, or you can wrap her up again and pick her up and, just rock her until she is comfortable before proceeding with your assessment. Alright, so I'm going to perform hand hygiene before making contact with the baby. And I'm going to check her ankle band to make sure that it matches the mother and that I've got the right baby in front of me. Then what I'm going to do before the baby begins to cry or begins to become uncomfortable, I'm going to check her breathing. So what I'm looking for is the effort and the rate of the respiration. And it should be between 30 to 60 breaths per minute. And then I'm going to auscultate her chest really quick, making sure that I warm up the stethoscope and checking her lung sounds bilaterally. And then checking her heart for rate, rhythm, and quality. So just like in the child assessment, I'm going to be checking the aortic, the pulmonic, the Erb's point, the apical, and the tricuspid for any heart murmurs. The rhythm should be regular, and also the heart rate should be 100 to 160, between 100 to 160 beats per minute. It could be 100 when the baby's sleeping, and it could go up to 160 if the baby's crying and when they're stressed out. Then while I have the stethoscope with me, I'm just going to check the bowel sounds really quick in the abdomen. It should be present times 4. And then I can take my stethoscope off and put it to the side. And I can check the umbilical cord really quick as well, making sure there's no signs of infection such as redness, swelling, or any abnormal discharge, to see if there's any pus that's coming out of the umbilical cord as well. Then finishing off my vital signs, just going to take the temperature. So putting the probe between the arms, just right at the armpit, the temperature should be between 36.5 to 36.5 to 37.5 degrees Celsius. And you can check the blood pressure as well, but if you do check the blood pressure, you have to make sure that the cuff is the right size for the baby, just because it's already an uncomfortable procedure. You don't want to make it any more uncomfortable for her. And so the blood pressure should read around 70/40. Alright, so starting with my very first measurement, I'm going to check the head circumference. So what I do is take a tape measure and put it right above the eyebrow and wrap it around the baby's head. And it should be between 33 to 35 centimeters. And then putting it to the side, then I'm going to palpate the head really quick to examine the 5 bones and the sutures. Some sutures will not fuse for another few months. And then just checking the soft spots of the baby's head, the anterior and the posterior fontanelle. Just making sure there's no bulging or depression. If there is bulging, it may indicate intracranial pressure. If it's sunken, then it will indicate dehydration of the baby, and that's not what you want. Then I'm going to check the head really quick. So just propping her eyes open gently, just making sure that the pupils are reacting symmetrically and appropriately to the light and that they're constricting at the same time. Then checking the nostrils and the mouth really quick for the membranes, making sure that it's a healthy pink and that it's moist. And then down to the abdomen to measure some more. So tape measure again to the umbilicus, right at the umbilicus, and then wrapping it around the baby's abdomen, just making sure there's no masses or bulging of the stomach, and then putting it away. So this is where the baby needs to be undressed, because I'm about to weigh and measure the length of the baby and do some really quick assessments while the baby's undressed. A tip is to put a pad or a towel on the scale. Like I said, babies do lose heat quickly, so unwrap the baby and support her head and just carry her and put her on the scale really quick, measure her, then place her back on the table gently. And then I'm going to measure her again, take the tape measure, measure her length from the crown to the bum, and then from the bum to the heel, making sure that toes are pointed up. So you're just checking for the general proportion of the baby, making sure that, for example, one leg's not longer than the other. Alright, then while the baby's unwrapped, just really quickly check the pulses, the brachial, and the femoral. And while you're down there, just check the genitalia really quick. There will be newborn girls after birth, they will have a white mucus discharge, vaginal discharge, and that's normal. You're also checking to see if the labia minora and majora are intact as well, and everything checks out. So quick reflexes that you can check is the palmar reflex. So put your finger on their palm, and they should wrap their fingers around your finger, or they should grip your finger. And then the Babinski reflex. So from the top to the bottom, just on the underneath their feet. So start from the top to the toes and work towards their heel, and their toes should fan out. And then last, you check the back of the baby. So what you do is you turn the baby on her back. So support her head by placing your fingers around her cheek and turn her around. And just checking to see if there's dimples at the sacrum area or along the spine. Just checking if there's abnormal curvature of the spine, and make sure that the spine is intact. Anything that needs further investigation, you should definitely note. Then you can turn her on her back again and wrap her up, and you are done the infant assessment. Thank you.